So, hello everyone, and welcome to this session on disability inclusion and humanitarian action. It's a pleasure to be here with you, dear NOHA cohort 2020, although being online only, but still it's a pleasure to talk you through the topic of disability inclusion. So my name is Sabrina. I'm working for Handicap International, which is also known as Humanitarian Inclusion, or short HI. I'm working for the project Phase 2, Leave No One Behind, which is a project that is funded by the German Federal Foreign Office and implemented together with the Christopher Blinden Mission and the Institute for International Law of Peace and Armed Conflict of the Ruhr University Bochum. So the project is really aiming at mainstreaming disability inclusion in humanitarian action by strengthening the capacities of German humanitarian actors when it comes to this topic, as well as their local partners. And then we're also active on global level. We've supported the finalization of the Interagency Standing Committee Guidelines for Disability Inclusion in Humanitarian Action. Quite long name, but you'll see it in the resource list. And we also strive at gathering more data on disability inclusion and on change processes for humanitarian or within humanitarian organizations. However, this session is really about raising your awareness and sensitize you about the topic of disability inclusion in humanitarian action by briefly referring to the human rights approach, talking you through barriers and risks, and putting everything together in what we call disability inclusive humanitarian action. So what's the human rights based approach to disability? Some of you might have heard about the Convention on the Rights of Persons with Disabilities, which is short known as UNCRPD. The UNCRPD was adopted in 2006 and entered into force in 2008. The UNCRPD really wants to promote and protect and ensure the full and equal enjoyment of all human rights by all persons with disabilities. That meaning that the UNCRPD doesn't grant any new rights to persons with disabilities, but highlights the rights that everybody has, but still refraining to persons with disabilities and granting them and promoting the respect of their inherent dignity. So that states really have to, for example, in a humanitarian context, really have to take all measures into account to promote and protect persons with disabilities in humanitarian settings. And this article is, or this is stated under the Article 11. So I was referring to disability, but the question is, what is disability? So a disability is most of the time referred to a person with impairment in interaction with an environment, which then creates a disability. So persons with impairments are women, men, boys, and girls with moderate to severe intellectual, physical, psychosocial, visual, speech, hearing impairments of different ages and statuses, and which, as I just mentioned, in interaction with the environment creates a disabling situation or service or society. While without any barriers in the environment, it would create equal and full social participation. So that's what we aim at, to have persons with disabilities or persons with impairments participating in society. But now that I said barriers, what are actually barriers? And we can divide barriers into four categories. It's institutional barriers, attitudinal barriers, physical barriers, and communication barriers. So some of you might have heard about these types of barriers, and there are certain examples. So for example, institutional barriers discriminative policies or programming tools, attitudinal barriers, misperceptions and stigmata, ignorance of the capacity of persons with disabilities, physical barriers, most of you might have heard of these ones, so distance to services or lack or insufficient ramps, and then communication barriers, which was a major issue now during COVID-19, where there was a lot of absence of sign language interpretation, live captioning, and easy to read information material. So just to highlight it again, a person plus a barrier creates a risk. And what you want to do is to reduce this risk. So you really need to eliminate the barriers, which means find an enabler to the barrier, so that you can increase the resilience, the safety and protection of a person with impairment, because persons with disabilities do face many or might face many risks in humanitarian settings. To put it a bit more in the frame and to let you know what number of people we're talking about. So persons with disabilities are actually an estimated 15% of the population, so of any given population. This means that when you don't have any numbers on persons with disabilities, to always calculate with a 15% of a given community that you're working for. Further, 1 in 5 women is likely to have a disability during her life, while 1 in 10 children is a child with disability. So what you do see here as well is that there is a difference between the number of persons with disabilities among children and women and elderly or older people. So this is going into the direction of intersectionality. And what I want you to know here and to remember here is that every person with disability has a gender, has an age, has a disability. Well, every person with disability or every person with impairment might have a disability and might belong to a different social economic status. So all of these different factors are somehow intertwined and interlinked. So every time you do an assessment, you should be aware of different or heightened risk for example, women with disabilities who are at higher risk of facing sexual violence, or higher risk for older people with disabilities, or those who are of low social economic status. So being aware of these factors which are intertwined and interlinked, these can create multiple and intersecting forms of discrimination, which you should really take into account. And now I'll stop speaking here and go over to our first surprise. Okay, everyone. So I was just mentioning that I have a little surprise for you. And I've actually invited 2 of my colleagues into this call to give you an overview about disability inclusion in practice. So first of all, I'm welcoming Toyin. Toyin is a disability advisor at UNRWA, so the UN Agency for Palestinian Refugees. And she's going to give us a short introduction into the context of Palestinian refugees, especially those with disabilities. Toyin is a really experienced disability inclusive development and humanitarian action practitioner and researcher. So I warmly welcome her to the presentation. So yeah, welcome Toyin.
Thank you very much for having me.
Thank you. So I'm just directly dropping the first question onto you. I was wondering if you could briefly explain to us about the situation of Palestinian refugees and especially persons with disabilities, which barriers they might face in the different contexts or are facing.
You know, the conflict has been ongoing for years, and now they are displaced in many countries. right now, in UNRWA, we work in what I can call technically 5 countries where we can find Palestinian refugees. And these countries are, they are Jordan, Lebanon, Syria, West Bank, and then Gaza. And the situation is such that they've been in these other countries for long, and despite that, they still live as foreigners most of the times, and then they don't have easy access to basic services like health, education, livelihood, and employment. It's difficult for them to access these services for one reason or the other, and especially because of their status in many of these countries. And then when we want to look at the situation of those Palestine refugees who have disabilities, then it's another context entirely, because now they are combining their status as refugees with disability, which is another disadvantage on its own. This makes it even more difficult for them to access these basic services. For example, in many of the countries, you'll find out that education is not accessible to children with disabilities. The provisions are not made for them. The schools are not physically accessible. The education instructions are not being delivered in accessible formats to these children. And when you go to the hospitals, you find out that even the hospitals are not physically accessible. And you can imagine a refugee who has a physical disability, cannot walk, will find it difficult to access health facilities in such settings. Likewise, in terms of livelihood, many of them, even when they don't have disabilities, are forced to work in the informal settings of the countries, and because of that, they are already limited. And when somebody now has a disability, in addition to being a refugee, it becomes more difficult because of negative attitudes of employers who believe that because somebody has a disability will not be able to perform, or they are not even providing reasonable accommodation in the workplace to make it easier for such persons to work like other people.
Yeah, I understand. I mean, you nicely highlighted the issue of what I explained before of intersectionality and then different factors coming together. So having the legal status of a refugee and then having a disability. I gather that for women with disabilities, the situation might be even worse. Do you have any recommendations for humanitarian actors to be more disability inclusive and to provide better access for persons with disabilities?
Yes, for sure I do. But first of all, I would say that as humanitarian actors, first of all, we need to be committed to disability inclusion, and that should then be concretely established. For example, the organization's mandate should actually state disability inclusion. If it doesn't state it, it's going to be difficult to effectively implement disability inclusive actions. And that could also be done by making sure that there's a disability policy in place and that the disability policy is being implemented. Then apart from that, then we should make sure that the basic services that we provide to refugees are accessible to those with disabilities. We can achieve this by, first of all, identifying the barriers in our service provision, in our programming. We identify the barriers and we remove those barriers, which is very simple. It's easy to do. And we do that using what we call the twin track approach. And another thing that we need to do as humanitarian actors is to also develop the capacity of our staff. Because most of the time we find out that people in humanitarian setting may not necessarily have disability inclusion expertise. And we can achieve this even if we are not going into disability inclusion fully. We can collaborate with organizations that work fully on disability inclusion, or we collaborate with organizations of persons with disabilities, so that we can make sure that we develop the capacity of the frontline staff and of our program people, so that they can effectively include persons with disabilities. Another thing is budgeting. This has been like a chronic challenge in disability inclusive humanitarian action. People often claim that, well, there's no budget. There will not be budget if we don't plan it. We need to plan it from the beginning. And that's also the reason why disability inclusion has to be part of our strategy from the beginning. If it is already part of our strategy, then it's easier to allocate budget to it and to stick to that budget, not diverting the budget for disability inclusion into something else. And one other thing is that as we develop the capacity of our staff, we should also develop the capacity of organizations of persons with disabilities. This is because when we do disability inclusion, we have to make sure that there is meaningful participation of persons with disabilities. This is very, very crucial. This is the only way that we can be sure that our interventions are going to be effective. We don't include them in passive manners, not only as beneficiaries, but also as decision makers, as experts in what we do, so that we can be sure that we are doing it appropriately. And lastly, I would like to talk about disability data collection. Without data, it is difficult to monitor inclusion. And when we cannot monitor inclusion, then our disability inclusive programming would not be a success. Thank you.
Yeah. No, I would totally agree, Toyin. Thank you. And you kindly provided all the must-dos and key actions that are really needed to provide a disability inclusive humanitarian response, which is the policies, the meaningful participation, coordination amongst humanitarian stakeholders, and engagement with organizations of persons with disabilities, the budget. So thanks, many thanks to you for highlighting all these recommendations and key points. And maybe just to highlight as a last point, the willingness. And that's where we are also approaching the students in showing willingness and willingness to learn more about disability inclusive humanitarian action, as they are the humanitarians of tomorrow. So many thanks to you, Toyin, for giving us this short overview. And yeah, thanks a lot.
Thank you very much.
So Toyin has already highlighted quite many barriers and also examples of disability inclusive services and must-dos. But if you want to have a look again at the presentation, you'll find a short definition of disability inclusive humanitarian action, which, and as she greatly explained, is really about identifying and removing barriers for those who are most at risk of being discriminated and excluded. And she also referred to key approaches and key recommendations. So again, removing barriers, meaningful participation, empowerment, and data collection, very important. So have a look at these again, but just to know that they are here in this presentation. And now over to my second surprise. Okay, everyone, so I'd like to invite Ulrike now into this presentation. Ulrike is former country manager for Somalia and Somaliland. She's just recently returned to her old position as an inclusive humanitarian action specialist, and she has a vast experience on disability inclusion, so I really warmly welcome her. And I'm going to ask her to provide an overview of the situation of persons with disabilities in Somalia. So Ulrike, maybe you can give us a short introduction to the context of Somalia and what our activities on disability inclusion look like there.
Okay, so Somalia, as most of you know, is situated in Eastern Africa, at the Horn of Africa. It's a semi-arid country with very low population density. It has been affected by civil war, we could say, over the last 30 years. And it is a context where you have peace and security in some areas, such as the internationally not recognized Republic of Somaliland, which is in northwestern Somalia, bordering Djibouti and Ethiopia. And you have the more insecure areas in south central Somalia, bordering Kenya, as well as also other parts of Ethiopia, where you have fundamentalist Islamist groups, and really the plural is the case, which is in conflict of varying density with the federal government of Somalia. As a result, you have very patchy control mechanisms by the government. So mostly they control the cities. And in the rest, in the rural areas, it's fundamentalist groups. Al-Shabaab, some of you may have heard that, have control there. What does it mean for persons with disabilities is that they're, like in other countries, estimated 15%. We don't have population statistics. They do face a lot of challenges to access services such as rehabilitation services, but also other humanitarian services, as they are not tailor-made to include also the access and communication needs of persons with disabilities equal to persons without disabilities. The humanitarian situation is dire generally for really big parts of the population, estimated 2 to 3 million persons at the moment who have issues to access water, who have issues to access sufficient food, because in addition to the man-made disaster and displacement, you also have displacement caused in addition, and sometimes we have multiple or triple reasons for displacement due to drought, flooding, recently also the locusts, and sometimes they also are affected these days due to climate change by typhoons.
Okay.
And our program, so we have really, with regards to humanitarian assistance, we are doing access to mental health and psychosocial support services for internally displaced people. We also refer people who don't have access to basic needs to other organizations who are providing basic needs. So that's the most at-risk population, including people with chronic illnesses, people with disabilities, female-headed households, older persons without families. We also support them to have access to functional rehabilitation services that we implement in Somaliland, in South Central, as well as in Somaliland. We also collaborate with other humanitarian actors to help them to become more inclusive. So we do capacity development of UN agencies as well as international NGOs, and we also engage in the cluster system for coordination.
Okay, yeah, thanks a lot, Ulrike. So you've already informed us about many barriers and challenges and the activities we are implementing. So do you see any other, or do you have any other recommendation for humanitarian actors to better provide disability inclusive services?
So what we've agreed to work with the majority of humanitarian actors is really to enhance the data collection. So at the very initial stage, the needs analysis, which in a country context like Somalia is ongoing. So there are annual assessments, but there are also sudden onset related assessments. So we really help them and recommend them to have disability data on number of persons with disabilities affected, as well as the type of barriers they're meeting in certain areas, and also what kind of protection risks they are facing. And protection risks, as you may know, is related to violence, abuse, etc. Some of those is disability specific.
Yeah.
And we, of course, also recommend them to have enough time to allow their staff and also authorities, if it's the local governments, to learn more about disability together with issues like gender or age, in order to make their programming more inclusive and to remove the barriers they may face.
Yeah, I understand. I mean, just maybe picking up the last phrase you said about learning more about disability inclusion, kind of what you're doing and teaching now as well. So that would be also your recommendation for students to be better informed about this topic?
Yeah, I think so. For students, I also would really recommend, like what we also do as we are the new humanitarian actors, is really to be able and confident to consult local populations, to give them the chance to give account of their situation. That means you need to know how to engage with people who are deaf, you need to know how to engage with people who are blind, who may have intellectual disability, mental health problems. Many people face issues to talk with people with mental health problems. They don't feel confident. So that is, of course, a key skill in addition to intercultural competencies to really be able to engage with them on equal and make sure that you don't indirectly discriminate against persons with disabilities in programming as well as in policies. And so, yeah, that's a recommendation. Whenever you hear something about a certain sector, try to not only think about the average population, try to make sure that you keep in mind a person, also the people we are helping to survive in a crisis. They are never only the people who receive our assistance. They are always a woman, a man, different age groups, their sister, a brother, a mother. So you really should try to open up your capacity as much as possible to be able to respond in a systematic manner to the different needs.
Yeah, I would agree. Active and meaningful participation of those who you also serve. So yeah, Ulrike, thanks a lot for taking part in this presentation. You gave a wonderful insight into the context of Somalia and barriers and challenges and recommendations for disability inclusion. So again, thanks a lot. And now the big question is, what can you do? And we were talking about this before. So really showing willingness, learn about this topic, know that there is disability, age, and gender. Not only speaking about gender or age. Challenge your professors. Ask about the situation of persons with disabilities, just as donors will be doing when you start your career, your professional career. So really take into account the situation of persons with disabilities and their needs, barriers, and find what we call enablers. So to actually leave no one behind. And to do that, to learn a bit more, have a look at our key resource list. And I do thank you a lot for listening in. It was only a short introduction. So if you have any questions, do not hesitate to get back to me, drop me an email, and I'll try to respond to it as soon as possible. Many thanks. Have a wonderful rest of the NOHA IP. Enjoy it, enjoy your masters, and maybe see you soon. Bye-bye.